12 minutes after 6 now, new health insurance reforms go into effect today.
And joining us on the phone right now to explain the changes, I know a lot of people have questions, Jason Moon from the Michigan Office of Financial and Insurance Regulation. Good morning, Jason.
Good morning to you.
Thank you so much for joining us. I know a lot of people are very excited about the fact that they're going to extend coverage for dependents, your children, up to the age of 26, but it's a bit confusing. That doesn't actually take effect right away, right?
Yeah, well, the law goes into effect today, and so insurers and employers providing dependent coverage to children are required to make that coverage available to children up to the age 26, and that starts at their next enrollment period, and that extension applies to both married and unmarried children.
All right, Jason.
Go ahead.
Alicia just brought up the extending dependent coverage. What are some of the other changes that people should be aware of, or do you think people are really going to be able to take advantage of?
Well, beginning today, insurers will be prohibited from denying coverage for children under the age of 19, so they'll have to accept any child regardless of their medical condition. They'll be prohibited from excluding coverage for that serious condition for children. Also important to consumers is new plans or renewed plans would be prohibited from issuing any cost sharing for preventative services. So you will not be given a deductible or a copay or co-insurance for preventative care measures such as immunizations or mammograms for women.
Also banning policy rescissions. That's when health insurance companies have retroactively canceled coverage. They can't do that anymore?
Yeah, they're not going to be able to go back and say, look, even though you have diabetes, you didn't tell us you had hay fever a couple of years ago, which is unrelated to your current condition. So they're not going to be able to go back and cancel your coverage unless you committed some sort of fraud or outright lied on your application.
Well, it seems like there are a lot of changes. We were just showing a few of those up in a full screen. It may be a lot for people to ingest right now when you're talking about 5, 6, 7 different changes. What kind of advice would you give people to make sure that they understand what they can do to find out how this can benefit them and their family?
Well, first we encourage them to contact their employer or insurer for any additional information on how their policy would directly affect them and their family. They can visit the Patient Protection and Affordable Care Act website at www.healthcare.gov. And then our agency, the Office of Financial and Insurance Regulation, we're here to answer any questions that they may have about an insurance product, an insurance company, agency, or agent. Our number is 877-999-6442. They'll get a live person anytime during the week. And they can visit us on the web at michigan.gov/OFIR.
I have a feeling you'll be getting a good number of calls and hopefully hits on your webpage today. Jason Moon from the Michigan Office of Financial and Insurance Regulation. Thank you so much for rising and shining with us and explaining all that. So helpful.
Thanks for having me.
Yeah, good information, definitely.